So there are great things that have happened in Chai during my time. I think we started off on a very powerful note of identifying a niche inside the HIV/AIDS space that needed the sort of skill set and sort of people and the sort of profile of the people that we were attracting. And that was the whole access work and price reductions in the ARV space. And that was huge, getting treatment down from $1,000+ per patient per year to just about I think it was $90 when the formulation was the basic one. It's a huge, huge achievement. And then making those price reductions actually work across all the countries that we've had HIV programs. I think we rewrote history, in the HIV space.
The fact that we were able to access this crisis in Africa is something that you cannot even put, you cannot put a price to it. It is one of the biggest things that ever happened, I think, in the medical field. Without this negotiated prices, majority of our people would have been dead. I mean, you cannot imagine what it is to lose 1/3 of your patients in 1 year.
I joined in 2005 when the PEDS program was first launching. And I think we realized at the time that the PEDS commodity work needed to have a programmatic component in order for it to be really successful. And so my role when I first came on board was to help design some of those programmatic elements and make sure that they tied in with the work that we were doing around getting price reduction for pediatric antiretroviral drugs and diagnostic commodities that we knew were essential.
Went into countries where there were no treatment programs, like Tanzania, and we had to go and write one. We came into Kenya and everybody was convinced that we couldn't treat children, period, because we couldn't find them. And we built a pediatric HIV program that's probably one of the best in that region. And we found the children when everybody was convinced that we couldn't find them.
When we started the work in 2005, there were literally fewer than 40,000 kids on treatment worldwide. And by the time that our program came to an end in 2011, at least the main piece of the program, that number had increased to over 400,000. So we'd really seen a tremendous global scale-up in the numbers of kids that got started on treatment. And I think what was really exciting for me about that work is that it really put us on the map as a global implementer, as an entity that had ideas and could make changes happen in the public health space.
So in Vietnam, we have a plethora of programs. When we first started in 2006, only about 9% of the children were receiving ART. And as of the end of 2013, that's gone up to 71%. So I think that's a really big impact that we've helped the Vietnamese Ministry of Health achieve.
I think learning from HIV is valuable. We have recently introduced TB in our program. TB has always been in HIV, and the access team has been using the same model that they have used for other communities in the laboratory space. So we are now applying that on the treatment side. So we are hoping we will introduce these new treatments, these new programs. Again, we want to conscientize the world and show them that this can be done.
Another nice impact is rolling out isoniazid preventative therapy for children living with HIV to prevent TB incidences. Based on our analysis in Ho Chi Minh City, children that get isoniazid preventative therapy and antiretroviral therapy, their TB incidences reduced by 97% compared to children that didn't receive either. So that was a really big discovery, and we're rolling it out nationally because we think that's going to have a really big impact on reducing TB incidences among children living with HIV.
Going into spaces and places where a whole bunch of people thought, there were no solutions or potential solutions, there were no possibilities, and making those possibilities, come to be and come true.